with our weekly live Instagram live session with a specialist doctor to take care of your concerns. Today, we have a very special doctor with us. Her name is Dr. Sujitha Natarajan, and she is specialist in pediatric surgery. So, Dr. Sujitha, welcome, and it's great to have you on the show.
Yeah, good morning, everyone. I think today's topic is going to be very interesting because it faces this problem. Either the child might be either overweight or underweight, but both today I think I can clear some of your doubts.
Sure. So, doctor, there are a lot of questions that come through our company's WhatsApp platform. We have on the Curica website a free of cost WhatsApp platform that a lot of users use across India, and we get thousands of query. From there, our team has selected some few questions which are most commonly asked, and I'm going to just discuss them with you. So, first question, doctor, what are some common nutritional problems that children may face?
Actually, most of the children might face, especially vitamin and mineral deficiency, which is essential for their growth and development. Child might have iron deficiency because the child is not taking proper diet. The first thing is going, so the child might have an iron deficiency, and vitamin D deficiency is also more common. Fed infants will be supplementing with vitamin D supplements till 1 year of age. Some child might take more food, so they might suffer with obesity, and the dental caries and cavities is more common. And some child might also have food allergies to certain foods. These are some of the common nutritional problems in the children which are affected.
Understood, doctor. So, doctor, a lot of worried parents, they come to us to ask what sort of a diet they should be giving to their kids, and at a very infant level. So, at what age, or especially for the infants, that they can start giving some cereals or some small fruits or little bit veggies. What age it is recommended?
Actually, till 6 months of age, only like exclusively one breast milk every 2 hours once you can give. But if you want to start after 4 to 6 months, but I prefer to start at 6 months of age because 4 months if you start, the child have some difficulty in swallowing. Child, so there is more prone for choking, and there is more prone for diarrhea, vomiting, everything. We start before itself. So if you want to start on semi-solids, better to start after 4. First start with some cereal based porridge like thing and smashed potatoes or mash. And there is a rule, 3-day rule. That is, if you start any new food, try only that food for 3 days so that you can find whether the food is adapt if the child has any allergy.
Right, doctor. So, doctor, how can poor nutrition impact a child's growth and development?
Previously, the child's nutrition should contain vitamins, minerals, proteins, carbs, because it's essential for the growth and development. The first thing is that the iron in a proper quantity, because this helps in the growth and development. It boosts the immune system. Vitamin D, which is essential for the bone growth and development. So you have to take vitamin B complex. Vitamin is essential for the brain development. And always I told calcium, the proper source of calcium is milk and egg. So you should take proper in your diet so that your child's brain growth as well as bone growth will be.
Right. So, doctor, can health drinks help in preventing nutritional problems in children?
It might help if the child requires proper nutrients. If your child pediatric is underweight and requires proteins and calories, then you can take health drinks, because supplement which is provides proteins as well as probiotics, amino acids which help. But these protein drinks must have some hidden sugars also. Not to give if your child has adequate weight or if your child is obese, because this will child. So better if your child is underweight or if the child needs protein, then you can go for this health drinks. But it should be suggested by the pediatrician. Brands has different composition. Only a pediatrician can suitable for your child, and they can provide you. So better if you see a pediatrician. And even you can itself in your home itself, you can prepare a health drinks by mixing a nut. Better to milk a health drinks. Better to mix the health drinks in your milk and give it like.
Sure, doctor. Sure. So, doctor, what are the signs of malnutrition in children?
Mostly your child will be underweight, and height is also will be, and you can see prominent bones will be seen, and their fat will be very less. His belly might be big, but the child's arms and legs will be thin. This is, we call it as accumulation of fluid. The child's belly might be big, but the arms and thin, be thin in that cases. And child will be very, very dull and will be very pale, because the child will be very pale and their hair and skin might be very pale. If you are easily pluckable, the hair will be easily pluckable and nails will be very brittle and become very tired easily, and they will be very dull and irritable. These are some signs of. If you find any signs in your child, take it to the doctor immediately.
Hmm. Now, doctor, there are many kids who, do not eat properly, and they're exposed to some good diet, but still, their eating habits are very, very less because they do not like to eat that much, because of which they do not get the appropriate weight that is required. So, is that a worrisome thing for the parents, or parents should worry about it, and then what they should do about it?
Yeah, many people will be telling my child is eating properly but not gaining weight or
Hmm.
gaining overweight also, because the child might be taking calories but not
Hmm.
is essential for this growth and development. If you give some processed food or any packed foods, these will increase the weight of the baby, but the child's growth and development only proper fruits and vegetables and proper diet can child's growth and development. So better if you have to give fruits and vegetables and some fast foods, even ice creams and chocolates, because these are some hidden sugars. These go taste but of the babies or child, but it won't improve your child's weight, hamper the growth and development of the baby. So better you can improve it by easily prepare some different dishes with the fruits and vegetables and make it attractive to the child.
Right, right. So, doctor, how can parents encourage healthy eating habits in children?
That's what I told. First, you can make the child eat together. That is what we call it as family meals. Because the child will tempt to eat by and try to avoid screen time. Many mothers I'm seeing they are using the phones, and this might be one reason that your child is not eating properly. Because they are concentrating eating properly. This might be one reason, and that's what I'm telling. Daily don't give sick. They get bored. So try to give different foods and different textures or shaped easily. Try to give some fruits and vegetables in add in the diet. Milk every day, 2 times a day, and egg either a boiled egg. You can give either an omelette so that your child takes, and try to avoid the fast food, because if they eat fast food, stomach will be full, so they won't eat whatever food you will be giving. So better try to your child improves their food habits.
Right, right. So, doctor, are there any specific nutrients that children commonly lack in their diets, normal diets that parents give?
Iron rich diet, because if the child is not taking proper green leafy they will be more prone for iron deficiency anemia, which is more common, especially nowadays common. And vitamin D, because vitamin D is mostly in the meats and eggs, and child who is vegetarian, they are more prone for vitamin D deficiency. And zinc, there are many kids are lacking zinc in their diet, so they are more prone for getting more infection. Then you have to see their zinc, because their zinc might be low. And deficiency, B deficiency, and what all essential fatty acids if your child is not taking proper diet.
So which foods contain these zinc and essential fatty acids, doctor?
Essential fatty acid is three fatty acids, which is more common in the fish
Okay.
and liver oil, because these fatty acids, which is essential for their brain growth and development. Zinc, if you take some dried fruits and green leafy vegetables, contains more of zinc. If your child lacks deficiency, the child lacks some minerals or zinc, then you can supplement it.
Okay, sure, doctor. So, doctor, what is the main cause of obesity in children, and what is the solution?
That's what I told. Nowadays, the childs are most fried items, packed foods, processed foods, spicy foods. These make gain weight because these are increased in the calories. So these childs take this diet, but less nutrients. They are more prone for obesity, and now because of increase, they are not playing, so that they have lack of physical activity. This cause deposited in the body, so they have an increased chance for obesity. What I told, try to avoid fried foods, processed foods. You can give just one frequently, because this might be one sign that your child is going into obesity, like their future life also.
Right, right. And doctor, what is the relationship between childhood obesity and poor nutrition?
That is, you will think that your child has immunity, your child has all vitamins and minerals. The child is actually taking more of fat content, but the vitamins, minerals, essential is deficient in these kids. So what are vitamin A, zinc, and everything will be deficient, especially in obese child, because these child disturbed. So these child won't properly absorb these minerals. Whatever they are gaining weight is because of this fat, not because of vitamins and minerals. Even if they take more diet, but they are malnourished in vitamins and minerals.
Right, right. So, doctor, now we have all discussed upon what to feed to child. Now, the next question coming in from listeners is what not to feed for a 6-month-old baby.
That's what 6-month-old baby, we have to start very slowly, like cereal based diet. Give cow milk, especially unpasteurized cow milk, or undercooked meat, or everything should not be given. Even salted, don't give so much salt. Just add salt in the diet, and try to avoid these foods, because even peanuts and honey should not be given of age. So because these foods are difficult to digest, and there is increased chance for food allergy in these kids. So better to start very slowly, like a solid diet. Even egg also you can give only after 8 months of age. Just and then you can start giving the egg white also. But first give it like a soup consistency. Then you can go for solid consistency.
And can we give fruits to a six month old baby?
Yeah, you can give fruits, but you have to give like mashed. You can boil the apple, and then you can smash it and give. And you can give smashed bananas you can give, and even papayas you can give, and mangoes you can give. Like citrus fruits like lemon and orange, because this will upset the stomach of them. Give like vegetable fruits you can just give apple, banana, and mangoes, and even the chiku is better for kids. But fruits and vegetables, you can give like potatoes and carrot. You can start it with.
Right, right. So, guys, if you have got any questions around nutrition of your children, you can ask in the comment section below. We will try to take them up during this session with Dr. Sujitha. Just in case if we miss out on your question, then we will try to discuss with the doctor and come back to you with a response to the doctor's questions. Also, we have got a free of cost WhatsApp platform on cureka.com. So feel free to ask questions to all the health experts with regards to skin care, hair care, nutrition, baby care, maternity care, elderly care, pain management, and wellness categories. So you can ask any question with regards to any of your healthcare concerns. Coming back, doctor, how does inadequate intake of vitamins and minerals affect a child's health?
That's what I told. If a child is not taking a proper iron or diet, if the child gets anemia, they will become easily tired and they have poor concentration. They won't gain weight properly. And if your child has a deficiency of vitamin D, which is growth and development, if your child has vitamin D deficiency, their bone is easy to get fractured. So they'll be very soft. So they'll get easily fractured. See, I told they're more prone for infection. So if your child might get easily diarrhea, flu, everything. If your child has zinc deficiency, the child might get. And calcium is also essential for bone growth. Having like vitamin A deficiency, they have some problem with their eyesight. So better to give like vegetables like carrots. It will promote your vitamin A in the diet also. So and diet, this is main important. If your child is taking like a proper fruits and vegetables, helps the digest properly. If your child is not taking proper fiber-rich diet, they have patient.
Right, right. Doctor, extending this question a bit, a lot of parents ask us that their kids are not eating proper vegetables and fruits, and they want to give it to them like cucumber, carrots, and all the fruits. And kids try to avoid it. These days they like more of the junk food. So, any tips for the parents on how to promote these foods, make their kids eat these fruits?
Actually, it's very difficult, but will the child eats? Because that's what I told. Just avoid junk foods, because if the child eats junk food and they won't eat fruits and vegetables, so try to attract the child. So first you start fruits and vegetables which is sweet, so that child might take. So you can start with either carrot, apple, everything. But you can make it like a salad, and you can keep it in the table, take and eat. And you also eat in front of the child, so that the child think that it is actually also eat. And if the child is not taking the fruits and vegetables, you actually make it as but add sugar, just naturally. You can make it as a fresh juice and give it every time. First time the child might won't take properly, but if you try like eat like it. But even if the child is not liking it, you can make it as a child might attract and eat it.
Understood, doctor. Yeah. Doctor, what are the potential consequences of excessive consumption of sugary foods and drinks in children? What may happen?
That's what sugared foods now there is all foods has child's palate will be tempted to sugar foods only. But these sugar foods only making the will be affecting in the future also, because the child tends to take more of obese, and there is increased chance caries and cavities because of. And if you take sugared foods, it will affect your normal gut flora also. So the vitamin is disturbed. So better try to avoid sugars. Even if you want to give sugar, and still limit it to less than 6 teaspoons per day. Just avoid less than is only acceptable, and try to avoid like hidden sugars where we give it in the chocolates. Try to avoid it.
Sure, sure. Doctor, there is a question coming in from a listener. His name is Syed. Syed is asking, "Good morning, ma'am. I have 2 months old baby and his weight is 4.2 kgs. May I know its normal weight?"
2 kg is very less, but I want to know the birth weight of the baby. Because birth weight might be lost during 7 to 10 days, and the baby might gain their normal weight only on. After that, the baby must be gaining the weight. I think 2.2 kg is very less, but I want to know whether baby so that I can
Sure.
whether the baby's weight.
So, Syed, can you please share with us what is the birth weight of your child so that doctor can help you? Yeah. So, moving ahead, doctor, are there certain foods that are essential for child's brain development?
That's what says, which is more in fish and liver oil is essential for this. And what all amino acids such as choline, folic acid, cystine, everything.
And what if the child is veg, then he cannot have the fishes and
That
all.
is vegetarian. We have to be concentrating on more because most of the because vegetarian, some child might take milk or egg. But if they are strictly concentrating on this, because most of the vitamins and B12, especially when present only in this vitamin B12 is present only in the meat, liver. In such cases, you can get like fortified vitamin B12 fortified in the market, so that this vitamin B12 can be introduced in the diet. Even after it, also if the child is deficient, we can give it as a supplement as syrup also. So if the child is vegan, you just go for more of protein rich diet like tofu you can give, and more of ghee you can add. Even if the child is vegan, you can give pure cow milk, so you can go for soya milk in such conditions.
Sure, sure. I'm sure that is very helpful for the parents. Now, moving ahead, doctor, how can parents address nutritional deficiencies if a child follows a vegetarian or a vegan diet? So that's the follow-up question for this. Yeah.
That's what I told. If the child is especially careful, because most of their deficiencies will be vitamin B12 deficiency and vitamin D deficiency. So you can now there is you can get some fortified foods like vitamin B12 and cereals is available. You can get that also, and you can just improve fruits and vegetables has. But I'm saying that vegan diet, the child is less prone for becoming obesity. So better vegan diet, you need not worry about that. Your child might not end up with obesity, but then you check on with the pediatricians, and if the child is lacking any of the nutrients, we can subs.
Sure, sure. Doctor, going ahead, what are the risks associated with early introduction of solid foods or formula feeding in infants?
Till 4 to 6 months, try to give exclusive breastfeed, because after 4 it will mature and child will attain proper head control, so that there will be no choke. System will get adapt to the whatever food you are giving. So better you start after 4 to 6 months, but don't start early, because I told there is increased chance for choking. You might lose weight if you start earlier. So better till 4 to 6 breast milk, and then I told what all foods you have to start slowly. Start like I just give one food for 3 days and observe whether the child is adapting to that.
Sure, sure. Dr. Sayyid has come back and he's saying, ma'am, birth weight is 2.9 kgs. Now he's 50 days old and his weight is 4.2 kg. Is it normal weight after 2 months, after
Yeah,
50 days?
it's fine. Yeah, he's gaining weight correctly. Only first 7 to 10 days there will be loss of weight. After that, the baby must should be grams per day during initial 3 months. So mostly your baby's weight might double around of age. So I think your baby is gaining weight adequately. You need not worry. Just continue 2 hours once.
Great. So, Sayed, I'm sure you would have got your answer. Your baby's weight is absolutely normal. And in case you have any other questions, please feel free to ask us. Moving ahead, doctor, what are the long-term effects of poor nutrition during childhood on adult health? So, when the child becomes adult, and if he had a poor diet in his childhood, how does it affect him?
One child is having underweight and another child is having overweight. Both is going to affect the child is not taking proper diet and underweight. That's what it's going to affect their. So it will be very difficult for the child to adapt in the school. So their academic and they're easily prone for infections because their immunity is going to be prone for infection, and they're more prone for going to develop some hormonal problem, diabetes. Even if the child is undernourished, also the child is going to develop diabetes and obesity. The child is more prone for diabetes, hypertension, and even for bone problems, joint pain. Everything is going to affect. Not now. It's going. So better if you treat it in the childhood itself. You are going to prevent the consequences face in the future. So better try to make this proper diet changes and so that your child growth and development is improved.
Sure, sure, sure. So, with that, doctor, I would like to just thank you for this session. It has been a great insight for a lot of parents across India. We got thousands of queries on nutritional problems. So, guys, I'm sure you would have got your answers. And you can view all this live session on YouTube, on Instagram, on Facebook, on LinkedIn, on Twitter, whichever is your favorite platform. We are live there, and you can check out this session over there. And you can ask us your questions with the doctors on those platforms, or you can ask us in the WhatsApp platform that is there in Curica. So thank you so much, doctor, for joining us. One more thing, guys, before joining in, we have got special offers going on Curica. So please do come in and check out your favorite products which you want for your healthy family, and you will find a lot of good offers going on right now. These are limited period offers going to expire by the end of September, and you can avail them as soon as possible. So please do give us a chance to serve you. We have got more than 7,000 products listed on our website, which are doctors curated website, and you will find all these products coming to you within a few days as soon as you order them. So thank you so much, doctor, once again, and wish you a very happy weekend.
Thank you.
Thank you. Thank you so much.